All right, I think we're going to go ahead and start. It's 2 minutes after. This hour will go by quickly. We do have Dr. Schlack, who's going to be managing the slide deck, and we'll just start with that information as we move forward. We're going to be doing a few introductions, and then we will get started with the presentation. So, Dr. Schlack, if you have the first slide.
Have you seen the slides?
We do. We actually see your slide screen. So I think if you press the presentation first and then select the screen, that will work out best. There you go. Terrific. All right, we are officially starting. So welcome everybody. We're really happy for you to be here. Just logistics and introductions. If you want to go ahead and click on that 3 ellipses and rename yourself, that would be appreciated. Include your name, your industry, and your preferred pronouns. If you have any questions, please include them into the chat box. We do have people who are monitoring the chat box, and we will have time for that. If you can mute yourself as well when you're not speaking, that will allow the presentation for one person to speak and everyone can go ahead and hear that. Thank you. Next slide. Terrific. Well, we have an exciting time right now, and I'm going to do the first introduction. Right now, with HILT and Healthier Here have been great partners. And one of the things that I'm going to do is introduce Dr. Susan Mclaughlin. She's the executive director of Healthier Here, and they have been an incredible HILT supporter and partner. I was browsing their website just this morning, and there was a quote right on the front page of their website, and I wanted to share that. It's people who are closest to the problem are closest to the solution. And that was really impactful. So I just wanted to pass that over to Dr. Mclaughlin for a few words.
Thank you, James, and hi, everybody. Good morning. Thank you for joining us today. Healthier Here is so excited to co-sponsor this series with the HILT. And I want to just really start by expressing my gratitude to all the health and social service workers that are on this call today. This is really for you and all that you have been doing. Our system has been stretched to its brink over the last 2 years. It was probably a fragile system to begin with, especially in certain parts of the system like behavioral health and social services where there was already workforce needs. And, we just need to appreciate, honor, and support in every way we can those workers that are out there, trying to help all the needs of our community and our region. And the series of presentations and discussions is really going to hopefully give some hands-on ideas about what you can do within your organizations to help alleviate some of the stress and support workers in the amazing and yet very challenging job that they have to do. So it aligns very much with Healthier Here and who we are in terms of trying to eliminate health disparities, improve the health of well-being of people in the region. And so we're just really excited to be in partnership with HILT on this and some of the other things that we partner on to really take care of our workforce here in King County and across the state.
Thank you, Dr. Mclaughlin. Really appreciate and really welcome Healthier Here in that partnership. We're going to begin with introductions. I'm going to go ahead and introduce Dr. Schlack. Tatiana Schlack is a PhD, PMHNP, an RN, FAAN, and FGSA, is a certified psychiatric mental health practitioner, associate professor of geriatric mental health, and a director of graduate education at the University of Washington School of Nursing. Her research and scholarship focus on informing healthcare delivery for patients living with dementia and their care partners. I'm handing it over to Dr. Mclaughlin.
Thank you so much. And I'm going to introduce our other 2 speakers today, Dr. Amelia Schlack. Dr. Schlack is a postdoctoral research fellow in comparative outcomes research at the Columbia University School of Nursing. She completed her PhD at the University of Pennsylvania as a T32 fellow in the Center for Health Outcomes and Policy Research, and as a Robert Wood Johnson Foundation Future of Nursing Scholar. Her dissertation research focused on the relationship between nurse burnout and patient outcomes, and we're very excited to have you with us, Dr. Schlack. Thank you. And I'll also introduce Amelia Eshado. I hope I'm pronouncing that right, Amelia. Correct me if I'm wrong. Amelia is a geriatric clinical social worker. She brings over 15 years experience working in multiple healthcare settings, including skilled nursing facilities, geriatric mental health, outpatient primary care, and home health services. She is currently a program and research manager at the University of Washington School of Nursing, focusing on dementia education initiatives and dementia care partner resilience interventions. Additionally, she works as a behavioral health provider at Providence Health Systems, where she provides counseling to healthcare providers, including doctors, nurses, medical assistants, staff, and their families. I don't know when she ever gets any sleep, but that's incredible. Welcome, Emily, and thank you to all of our speakers. We really look forward to hearing your wisdom today.
All right, Dr. Sadak, y'all are up.
Well, we are very excited to present to you part one of this two-part workshop on burnout prevention. And our objectives today are to give you just a brief definition of clinician burnout in a context of the pandemic, and to review some organizational and health system strategies, as well as individual strategies for preventing and mitigating burnout. We are hoping that you're going to join us again in January for part two of this experiential workshop. So our goal today is to give you introduction and a little bit of information of what we know works well from organizational and self-care standpoint in managing your wellness and preventing and mitigating burnout. And we are going to assign you some homework, and we hope that you will take on our challenge and work on implementing some of those individual and organizational strategies in your work and your everyday life. So when you join us again in January for a 2-hour part two of this workshop, we're going to be sharing with each other about our experience with utilizing these strategies. And we're going to really support each other in developing an organizational and personal care plans. So this is just an introduction, and we really hope that you will join us when we get to learn from you and from each other. So very briefly, when we talk about burnout, it refers to physical, emotional, and mental exhaustion caused by long-term involvement in emotionally demanding situations. And several large contributors to burnout are role overload, role conflict, and stress injury. And stress injury can come from events that are life-threatening, experiencing loss in a conflict, and kind of overall wear and tear. I want to point out that, we have very solid research evidence that shows that individual provider burnout leads to significant health system and patient outcomes. So our main takeaway from today's presentation that our wonderful speakers will give you a lot more information about, but the main takeaway is that it is your moral responsibility to take care of yourself. And as a healthcare leader, it is your moral responsibility to take care of your teams, because it is not just about you and about your team. It's about your patients and their outcomes. It's about their families, and it's about our healthcare system and the life of our country in general. So this is really important. It is not selfish to take care of yourself. It is selfish not to. So this is the biggest takeaway from this presentation. And lastly, before I give the stage to our wonderful speakers whose presentations I will be moderating for you today, I want to introduce you to a stress continuity model. And this is important to put future presentations kind of in a context for you. So when somebody is undergoing significant stress, but they have a lot of reserve, they are functioning optimally, they're doing well physically, emotionally, spiritually, they're ready to take it on. They're able to manage even acute stressors and not become ill. When they're experiencing stresses over time, or when the immediate stressor is just so severe and a person does not have sufficient reserve, then they start reacting and not really responding, right? And they're experiencing somewhat mild transient stressors that may manifests itself as irritability, loss of motivation, loss of focus, and some physiological outcomes. But when stress is prolonged or severe and person is not prepared and doesn't have reserve and doesn't start from a place of optimal wellness, then a more severe stress-related injury takes place. And a final stage of the stress continuity model is diagnosable illness, as post-traumatic stress disorder, depression, anxiety, substance abuse, and many physical manifestations. So this is a little bit of a context for the presentation that you will hear. I am so excited to learn with and from you, from our wonderful speakers. And right now we're going to learn from Dr. Amelia Schlack about institutional strategies to reduce burnout. And we're so fortunate to have Amelia with us today because she is one of the emerging leaders in developing evidence-based science for understanding the causes of institutional burnout and organizational strategies for mitigating it. Thank you so much, Dr. Schlack.
Hi, everyone. Thanks, Tatiana and members of HILT for having me here today. I'm really excited to speak with you. So as we talked about, I'm going to be discussing institutional strategies to reduce burnout and improve retention. And we can go ahead and advance the next slide. But before we get started, I want to provide a quick overview of our agenda. So I'm going to discuss what burnout is and what it isn't, some of the common causes, and dispel misconceptions about burnout, particularly in relationship to the COVID-19 pandemic. I'm going to wrap up with institutional strategies that you can apply to your organizations and then open up for questions and discussion. Next slide. So as a quick note, I'm going to focus this talk on nurses and use them as an example, but the themes and strategies that I'm going to be discussing today apply to all clinicians. Next slide. Perfect. So there are 3 defining features of burnout, including emotional exhaustion, cynicism, and low self-efficacy or low levels of personal accomplishment. And what makes burnout is its relationship to the workplace or a poor work environment. Next slide. So there are a number of ways in which a poor work environment contributes to burnout. And the primary ways in which we see that manifesting are having a heavy workload or a lack of resources. So this is when one has too much work without enough time or resources, and this is a consistent predictor of burnout. For nurses, this is most often defined as having inadequate levels of nurse staffing, and this is also inclusive of support staff. There also needs to be time to discuss patient care issues with other nurses and clinicians. Lack of autonomy is also a really important factor, and it really depends on whether nurses are involved in organizational decision-making. Poor administrative relationships are also critical, and this is really set by leadership and management at every level within an organization. And then finally, the presence of hostile working relationships among colleagues is also a consistent predictor of burnout across occupations. And this can be hostility between nurses and nursing assistants, or between nurses and physicians, to name a few examples. But the point being is that if you're working with someone and you feel like you don't have a good relationship, it's going to affect your experience at work. Next slide. So you can see that burnout is not really about the individual, but rather a reflection of the context that someone is working within. And consistent with this understanding, the World Health Organization has defined burnout as an occupational phenomenon, not a medical diagnosis, which highlights its intrinsic tie to the workplace. Next slide. And here, I really love this quote by David Mechanic because he's highlighting the system context. And here he says that job stressors are not amenable to individual solutions, but depend on highly organized cooperative efforts that transcend those of any individual, no matter how well developed his personal resources. So what this is saying is that the job stressors that contribute to burnout are too powerful for a single individual to overcome or cope with, no matter how resilient they may be. So again, this is saying that burnout is really not about the individual, but a reflection of their workplace. Next slide. So to sustain nursing and the broader clinician workforce, it's imperative to decipher between unavoidable sources of occupational suffering, which are inherent to a nurse's role. And this may be bearing witness to death and dying, and other clinical stressors that go along with this work. And then on the flip side, the other is avoidable sources of occupational suffering, which is what I'm focusing this talk on today. And while resilience capacity building is key to addressing the unavoidable suffering that's associated with clinical practice, these sources of avoidable suffering should be prevented and resolved at the organizational level. And so this is where I'm calling on you as organizational leaders, administrators, and managers, is to address these avoidable sources of stress. Next slide. So before we do that, though, I want to dispel this common misconception that nurses and clinicians are leaving their jobs and they're burned out because of COVID-19. This really mischaracterizes the problems that clinicians are facing. Next slide. In reality, the pandemic has exposed and amplified long-standing occupational circumstances of nurses. And if we are to address burnout, we really need to focus on these work environment features. Next slide. So there is scientific consensus suggesting that understaffing, poor work environments, and a lack of a robust ethical framework are the primary contributors to the development of both burnout and moral suffering among nurses. And while moral suffering can contribute to the development of burnout, the two are distinct based off of their differential causes. And so I'm going to focus this talk on burnout, but I'm happy to answer any questions that may arise around moral distress. But essentially here, the point is that there's agreement that these poor working conditions that lead to both burnout and moral distress were prevalent before the pandemic started, and now they've been amplified. So next slide. For reference, the following recommendations that I'm going to provide are adapted from an article that I co-authored in 2020, which focused on institutional recommendations to sustain the nursing workforce in the first year of the pandemic. We've since followed up with an expanded blueprint, which is going to be available in January of 2022. And lastly, I'm also going to review some recommendations from the 2004 National Academy of Medicine report, because the features that are good for patients are also good for nurses and other clinicians. Next slide. So to improve the work environment, I want to walk you through a couple of ways in which you can target on these 4 areas, because the themes of autonomy, working relationships, resources and workload, and administration, leadership, and management, these are all consistent predictors for burnout and other workforce outcomes. And I'm also going to give you homework that outlines some specific tasks that you can try. And so I want you to think about, as I'm talking, about maybe other ways in which you may improve nurse autonomy, for example, and then also how you might apply some of these examples to other types of clinicians. Next slide. So the first and important area with autonomy is to ensure that those who are carrying out the work have control over their day-to-day responsibilities and that they're involved in the decision-making processes about their workflow. So processes should be scrutinized and determined if necessary for the delivery of safe care. And a good example of this is electronic health record documentation. It represents a great burden to clinical nurses and other clinicians, and it's been linked with burnout. And really, we want to shift our focus from documentation to supporting nurses' workflow in real time. So special attention should be given to time-intensive processes like patient admissions, medication administration, and other high-priority practices by unit. Other systematic barriers that may affect workflow and that should be further examined are lack of continuity among the medical team, ineffective communication, and conflict among clinical decision makers. Next slide. Another way that we can address autonomy is by restructuring as a flat organization. And so what I mean by this is, instead of having a vertical or very hierarchical organizational design where each decision has to be leveled up before a final decision is made, we want to avoid this level of micromanagement and decentralize decision-making processes to empower direct care nurses and their supervisors to make decisions quickly and efficiently without burdensome administrative or unnecessary clinical oversight. Next slide. So working relationships can be improved by fostering interdisciplinary relationships. So here I'm encouraging you to think about how the well-being efforts of nurses and non-nurses can be aligned through collective initiatives. And so some of this may be achieved by transdisciplinary training and education across health professionals, as well as a transparent dialogue about the barriers and facilitators to adopting such a model. Healthcare leaders can also support collegial relationships through interdisciplinary rounding and shared continuing education models for all clinicians on a continuous basis. Next slide. Another critical area is resources and workload. So we want to ensure that nurses and clinicians have enough resources to get their work done. And staffing is definitely a huge part of this, but so are physical resources, like having enough pillows for patient beds. You know, some patients require 6 or more pillows to position them properly. You also want to consider patient recliners, IV pumps, vitals machines, and computers and scanners that work. We don't want nurses spending 15 or more minutes looking for a vitals machine only to arrive to a patient room and discover that it doesn't work. It's happened to me too many times, and it's really frustrating, and it definitely affects your workflow. Next slide. So it is also important that we talk about staffing because we need enough nurses and clinicians to safely deliver care for patients. And so part of the way to do this is to ensure that nursing leadership has control over staffing and that the decisions around staffing are based on census and acuity, not only the budget. And I recognize that staffing isn't a problem that's going to be solved overnight, but I encourage you to think about your overall investments in nursing because this has time and time again been linked with patient outcomes as well as nurse outcomes. But I also want to point out that these solutions don't occur in a vacuum, and you could have the most well-staffed organization, but if you have a terrible work environment with hostile relationships and ineffective management, you're not going to see the benefits of the extra nurses that you staff. So my point here is that the solutions do not occur in isolation and that an investment in staffing occurs alongside an investment in other work environment features. Next slide. So next, I want to move on to our last theme, which is administration, leadership, and management, which is really important because it sets the tone for the organization. So here I'm encouraging you to make top leadership accessible to nurses. And so I assume and hope that nursing leadership is able to round regularly and have face time with direct care nurses. But I also challenge you to consider whether non-clinically oriented executives are known to direct care staff. So do nurses know who their CEO and CFO are? We want nursing and non-nursing leadership rounding on units to see how their organization is running and to connect with nurses and hear their concerns. So to do this, I encourage purposeful roundings. This is where you go onto the unit, not just to observe, but to ask clinicians targeted questions to elicit the information so you know what's going on. So you can ask questions like, what is going well today? Is there anybody that I should recognize for exceptional work? Are there systems that need improvement? Are the necessary supplies and equipment available? And is there anything I can help you with right now? When we think about why patients are in a hospital or long-term care, they're really there not just for a diagnosis, but for nursing and direct clinical care. And they need this on a 24/7 basis. So when I look at administration's role, I look at their role as supporting frontline providers in care delivery. And so this is where you reach out to direct care staff and see what they need to do their job well. Other than purposeful rounding, I also encourage you to think about other ways you can be accessible to your staff. So this may be a CEO forum or a lunch with the director, among others. Next slide. So I also want to mention well-being governing boards because I see this becoming more popular in all types of organizations. So in this case, your board would need robust clinical representation and it would focus on the physical, psychological, spiritual, and moral well-being of your workforce. And so the first step in doing this is to convene leaders. And so you'd want clinical leaders, managers, administrators, financial leaders, and most importantly, direct care staff on this board to identify how managerial, policy, and financial decisions affect the delivery of clinical care. We want all of our stakeholders to be educated on how administrative oversight, management practices, and budgetary allocations impact clinician well-being. The second part of this would be to create and monitor standards that protect well-being. So we want to protect nurses and other clinicians from practices that promote excess fatigue. One example of this is mandatory or voluntary overtime. Another one is just having the time to take a break during your workday. Next slide. So the last area that I want to mention is how leaders can prioritize professional development. And people don't necessarily look for just work or a job. They look for a career with upward mobility. And some organizations do this really well for nurses, particularly with clinical ladders and promotion opportunities. But I really encourage you to think about how professional development opportunities could be available to all staff. And so this would include continuing educations, opportunities to transition into new roles, and also advancements in the clinical ladder or role tiering. Another option is to incorporate individual development plans into annual evaluations so that organizational leaders can proactively work to identify the professional goals of an individual and see how an organization can help them achieve it. Next slide. So I want to wrap up today by saying that the structural foundation, or these structural changes I discussed, are foundational to achieving any of the long-term benefits of cultivating individual resilience capacity. And what I mean by this is that organizational leaders sometimes tend to invest in stress management programs and place the burden of resilience capacity building on individuals rather than improving the working conditions that cause it. And while individually focused strategies offer really important tools, my point here is that individuals have to be empowered to engage in resilience capacity building at a system level. And so if changes to address well-being solely target the individual in the absence of supportive policy improvements, they're likely to backfire and contribute to further workforce demoralization, because there's a message underlying that you're not resilient enough for this work, when in reality, when you're working in a toxic and unsupportive environment, no one is resilient enough to cope with that, and people will ultimately look for opportunities to leave. So I encourage you to look at the pandemic as an opportunity to reevaluate priorities moving forward and think about how you can make structural changes to your organization to support your workforce. And with that, I just open up for questions and discussion.
Thank you so very much, Dr. Schlack. That was an amazing presentation. We got wonderful feedback for you in chat. And there's one question. You mentioned that the strategies that you're recommending can be generalized and expanded to other health professions. And the question is, how can people learn more about applying the strategies? And, I can start answering it briefly by saying that Amelia prepared a wonderful handout for you all with your homework, and she'll introduce it a little bit later, that breaks down what you could be doing for trying to implement each one of these strategies. And it doesn't have to be limited to nurses, but I would defer to an expert to expand on that question. How do we make this more generalizable?
Sure. So in the homework handout, you'll see that I've divided strategies into 4 themes, which include autonomy, working relationships, resources and workload, and then administration, leadership, and management. And so I've given you a few different goals to think about and homework to start implementing over the next month before we meet again. But in general, I think starting with workflow is a really good option. And so nurses or other clinicians who are not nurses really need to have a say in their day-to-day workflow and processes. So they should be involved in committees that design workflow. And I think, I am a nurse, and so a barrier that I often found and other nurses find in participating in committees is that they don't have the coverage or the staff to go to a committee meeting during their workday. And so how can we ensure that there's the staff coverage? Or if a meeting is on someone's day off, is there a way that engagement can be facilitated remotely? And these issues don't just affect nurses, they affect all types of clinicians and people outside of clinical care. So the same ideas can be applied.
Thank you very much. So you've given us wonderful things to consider, but do I have to be a CEO or director of nursing or high-level manager to apply the strategies?
Sorry, could you repeat the question?
So do I have to be a high-level manager, a CEO or director of nursing to apply these strategies?
So no, but I do think that the CEO and top management do set the tone for the organization. So partnership with them is critically important, but these decisions occur at every level. So starting with your nurse manager, who may oversee your one unit and a group of nurses, but extends to nursing directors who oversee nursing managers, and then a CNO who oversees everybody, and then beyond a CNO, we look at our CEO and chief financial officer. So you don't have to be the leader of the organization to make these decisions, but I would like to see a partnership and a general organizational, I guess, agreement that these things need to be prioritized.
Thank you very much. And on chat, our audience is fully agreeing with you. And there was another question which I would like to reframe to a challenge to our audience. The question was to Amelia if she could address supply issues, and that it's definitely leading to burnout when you have to spend a lot of time searching for supplies. But instead of posing this question to our speaker, I would like to pose it to all of you as a challenge, because we hope that you will join us again a month from now. We would challenge all of you in your organizations to think about creative strategies for solving the supply issue. And when we meet and help you facilitate kind of small group brainstorming discussion, we would like to learn from you what you've tried, if something worked, wonderful. If not, what got in the way, and we can help each other, to think through and how to solve this. But for now, we're going to stop our Q&A and we're going to continue our presentation right now with a focus on individual self-care strategies. And we're going to give a stage to Amelia Eshado. Again, we are so fortunate to have Emily with us. Not only she is a very brilliant, gifted clinician, but she's also research interventionist, and she co-developed and implemented a research study which proved to us that the strategies she would be suggesting to you today actually work. And she'll tell you more about that, but again, just really going to be a treat to learn from Emily.
Thank you so much, Dr. Schlack, and thank you, Dr. Schlack, too, for all of that information on the organizational end. And yes, I'll be now talking about on the individual side of how we can better develop our self-care habits for, improved well-being. So next slide, please. So first, why are we talking about self-care? Why should we engage in self-care? What's the purpose or the benefits? So first, looking back on Dr. Schlack's, when she was sharing the the stress continuum model, it does mitigate the effects of stress. It would help us to keep in that green section of where we can really mitigate that effects of stress, where, we reduce the risk of burnout and compassion fatigue, and also at the same time improving or sustaining good physiological and behavioral health outcomes. So that could be like, good blood pressure, improved mood, good energy, increased concentration. And then as, Dr. Schlack was saying, yes, we did a pilot of a self-care intervention with dementia care partners, which you can certainly think of dementia care partners as a big role of the healthcare provider team. And they're providing a lot of healthcare and assistance to their care recipients. But as a result of them engaging in this self-care intervention and improving and increasing their self-care, they reported, they felt more at peace. They were feeling more hopeful. They were less strained and frustrated with the caregiving situation and their role, which is a lot of work. And at the same time, feeling less helpless and almost the sense of acceptance of their situation. Able to engage in their role as the care partner, more patient, less depressed. And a running theme along a lot of them was this sense of, I understand and I get it now. I need to give care to myself to give care to others. One person, another quote that she said was, I can give because I received. So she understood by giving to herself, she would now have that increased capacity to give. And a lot of what I think is, also happening here is that there's this sense of, dementia care partners and perhaps, people in this caring profession, healthcare providers and such, we get lost in that role. We think, dementia care partners put all of their energy into the person that they're caring for, and they lose that sense of self. And so really by doing that self-care, it's like they're honoring themselves and their, individuality and their own needs. And then they kind of bring the focus back to, I'm a person who deserves this as well. And then they're able to give again to other people. So it was a really, yes, amazing feedback and experience of those dementia care partners. So that's why it's, important. So sorry, next slide, please. So what is self-care? What are we talking about? Self-care, there actually really isn't a consensus on the definition of self-care. So instead, we'll kind of talk a little bit about the characteristics. There's this, the capacity to act and make choices. Because since there's no consensus, it's because it's kind of based on the situation, based on the culture. So it can be, situational and culture specific. It's influenced by our knowledge, our skills, our values, our motivation, our locus of control and efficacy. And it focuses on the aspects of healthcare that's under our individual control. But for the purposes of today, and to kind of put a framework around, what we're going to be talking about with regards to self-care, I'm going to use this definition. So personal self-care is defined as a process of purposeful engagement in practices that promote holistic health and well-being of the self. And professional self-care is understood as the process of purposeful engagement in practices that promote effective and appropriate use of the professional role within the context of sustaining holistic health and well-being. So, next slide, please. So now, what is a self-care activity? What would that even be, or what does that look like? Really, it can be anything. I would encourage you to be creative and just really think about what brings you joy. What feeds your soul? What rejuvenates you, gives you that energy? And there's some categories of self-care that we can look at too, to just kind of give some examples of things that you might want to try. We have the universal, which is like things that we all kind of need to do to just survive. And that's like eating regular meals, drinking water, getting adequate sleep, taking any medications as prescribed. Then we have health promotional activities, which are things that kind of promote improved health and well-being. And those are things like exercise, sports, outdoor activities, listening to music, reading, watching TV or the internet, meditation, prayer, or spiritual activities. And of course, that socialization or connecting with other people. So spending time with friends, families, and our pets. And then lastly, some professional developmental activities as well. This could be things like setting boundaries, learning to set your own boundaries in that professional sense or personal, asking for and accepting help when it's available. And then maybe even, looking at seeking education or training on stressful or difficult tasks to kind of reduce that sense of stress or strain with these, challenging tasks, so improve our capacity to do various tasks. Next slide, please. Okay, so now we're going to talk about how we're going to go about developing a self-care habit. And so there'll be 3 steps that we'll be talking about. And the first is going to be about inventorying your views about self-care and your current practices. Then it's going to be working on setting an objective and measurable goal, and then developing that goal into a habit for automaticity in doing these self-care activities. So, next slide, please. So first step, right? Inventory, trying to figure out how do we feel and what do we think of it? So first, kind of defining self-care. How do we define it for ourselves? What does that mean to us? What does that look like to us? Next, kind of evaluating how do we feel about it? How do I feel about engaging self-care? Is it a good thing? Is it a bad thing? Is it wasteful? Is it something I wish I could do, but I can't? I don't have enough time. So what are our feelings, our attitudes towards self-care? Next, look at what are our current practices? What do I currently do that's self-care? Is it the eating regular meals, making sure I do that? Is it making sure I get out once a day, to take a walk? So what do I currently do? And then kind of, and as we're exploring self-care activities, identifying some that you would most like to increase. What are some ideas that you have of things like, gosh, I would really love to do this because it would make me feel this way. So just kind of start brainstorming some things that you would like to improve and do. So next slide, please. So 2, we're going to start working on setting the goal. And of course, using a SMART goal model, which in the healthcare provider industry, maybe you're very familiar with SMART goals: specific, measurable, achievable, realistic, and time-based. Okay. So as we're thinking about these self-care activities that we would like to try and develop, It's good to start with one because, doing more than one can become overwhelming. And if we don't get to achieve all the goals, sometimes we feel this sense of self-defeat and then, might lower our motivation. So really at first, try to focus on one. And I encourage you to really focus on the activity that is most important and would have the greatest impact on you. And when you're thinking about that goal that has most important and greatest impact, really start thinking about, how is this going to benefit me? Why is it important to me? What kind of impact do I envision it might have? How is that going to look in my general life once I start to do that? And by doing this, you're actually utilizing a lot of motivational interviewing skills on yourself to really kind of help define what it is that you're seeking, what you value, and what you're hoping to get out of this activity, how it's going to feel and affect you. And then you want to figure out that first step. And, like we said, start with one goal, start with something kind of small too. As an example, if your goal was like, oh, I want to run a marathon. Well, you're not just going to go out maybe and run 26 miles, but what is that first small step? Where are you at right now with, this whole goal that you have? And what is kind of like the first small step that you would like to do? And so really evaluate, is that achievable? Is it realistic? And sort of kind of think through that. And then of course we want to be specific and measurable, and this really helps us to stick to a goal. If it's too ambiguous, then it might be kind of confusing. So it would be something like, I will do this action at this time in this location. So maybe if you're thinking about, running a marathon, I can run a mile. So I will run a mile in the afternoons or at 5 p.m. after work, outside or something, as an example, in the park. Maybe you'll go to the park. Okay, next slide, please. Okay, and then, next is, developing this into a habit. And this helps both with the sense of making it something automatic and part of your routine, but also as a reminder, because when we're developing new habits, when we're doing the study, it was like they were kind of confused, like, when am I going to do this? And then we follow up with them and they forgot to do it. And so this is also helping you as a reminder to do the activity and to help develop it into more of a habit. So think about the time, the action, location. What is something that you do that is close into that time? And then create a plan to connect that new action to the existing habit and implement it. So sorry, next slide. So after I do X, Y, Z, I will do this new habit or this new goal. Okay, next slide. Okay, so now I'm going to kind of walk you through a little bit of the homework that I would like you to work on and do, where you're going to be ultimately trying to work on developing a new self-care habit or and routine. So basically, this was the first one where we're inventorying, and we can go to the next slide. Thank you, Tatiana. Where we're going to kind of talk, start asking yourself these questions. How do I define it? Maybe you're like, oh, it's an activity that, I think where I just do something nice for myself or do something to help me feel better. How do I feel about it? Well, I mean, that'd be nice, but I don't really know if I have time for it, but I guess it'd be nice. What do you currently do? Well, I play tennis. So I play tennis, twice a week. And then this is where you're brainstorming. What things would you like to do more of? Maybe it's running, meditation, hiking, improving your diet, dietary choices, playing with your pets. Okay. And so next slide. And so this is like the step 2 where we're going to start trying to define it and narrow it down to a goal. So next slide, please. So as an example, what is most important and have the greatest impact? And maybe I figure out, well, maybe it's running, but why? How is it going to benefit you? Well, I'm going to feel better. I'm going to get into better shape. I think I'm going to have more energy. I'm going to feel good about myself. I think I'll feel stronger, and I'll feel good about accomplishing this activity because it's not something that I, always necessarily like. However, I always know after I do it, I feel good. And I think I'll just be happier if I know that I'm, doing something. If I feel good about myself, then I think I'll feel happier too. So what's the first step? And I'm thinking to start small. So I'm going to run every day and I'm going to run 3 miles a day. So let's double check that. Is that achievable and realistic? 3 miles. I haven't run in a while. So 3 miles is probably too long. You know what? I'm going to do a half mile. I know I can absolutely do that. and I'm gonna commit to a half mile, right? And then make it specific. So time, action, location. I'm thinking about it's rainy in Seattle. I do have a treadmill. So I'm gonna run a half mile on my treadmill in the mornings. Okay, next slide, please. And so this is where, again, I will do X, Y, Z at this time in this location. Okay, next slide, please. And then now I'm going to connect it to the habit. So I want to run on the treadmill in the mornings. What do I do close in that time? Could be you have your morning coffee. I always brush my teeth. I always, I look at my phone personally, first thing in the morning. So what is the thing that you do first thing in the morning, or, that you want to connect that to? And then we create that plan. So next slide, please. So running in the mornings for me, okay, maybe I brush my teeth every morning. That's the first thing I do. And so just connect it. And then as an example, after I brush my teeth, I will run at least a half a mile on my treadmill in the mornings. And then you just figure out the date that you want to start implementing it. Can you get started tomorrow? Do you want to get started on Monday? What day do you want to implement? And so then again, we have that kind of guide. After I do X, I will do this new habit. Thank you. So yes, any questions or?
Thank you, Emily. While people are thinking of their questions, I would like to ask you a question. This is very helpful, and you made it sound so simple, but what if I wake up in the morning and I just don't want to be running on my treadmill? How do I get myself to even get going? What if I'm just exhausted? And a comment came up on chat saying nurses don't even get breaks, they work double shifts, What if how do you help yourself to motivate yourself?
Right. And so sometimes it's, again, going back to what is it that you're seeking and hoping from, or envisioning that you're going to get from this self-care activity. And then it's just creating a smaller step. The people that we worked with, they were like, I'm going to walk every day. And we're like, what's the first step? When you visualize doing this activity or this thing that you want to do, visualize all the steps, visualize how you feel at each step. Where is the area that you're going to feel like, oh, forget it. I'm too tired, and I don't want to do this anymore. And, one of them, we did a small step of she's going to set her clothes out every day so that she's ready to put them on and go walking. Does it mean she actually has to go walking? No, but that first small step towards, trying to get to actually walking every day. And by doing that, when you set a smaller goal, you can always do more. If I say I'm just going to run a half mile, I can go 3/4. I can go a mile if I want to. You don't have to, restrict or limit. But sometimes setting that small step that's really achievable. And once you sort of, in your mind, all the things get motivated and going, then it kind of can lead to the next thing. So it's really being okay with set a small step, because it just starts with, a small step to start. And then you're talking, the nurses that work double shifts, you're saying, and
no, you answered that question. When you're just too exhausted to do even a small activity, what you're saying is that just setting out my running shoes could be my activity. So what I'm hearing you say is that you have to choose your initial activity that's relatively failure free. Right? That doesn't require a huge commitment, that you can do, and tying it to something you do every day and making it very small and gradually growing it is how you address the motivation challenge, right?
Yes. And if there's no other questions right now, I can also just kind of briefly go over kind of objectives for session 2 for regards to this. Is that, or?
Emily, there are a couple questions in the chat.
Okay.
So a couple of the questions are around getting leadership buy-in. And so I'm wondering if you have any suggestions around that. So one thing that Suzanne commented, are health systems building in leader incentives to foster and promote these activities? And how do we measure success for addressing these for leaders?
I was wondering if it would be okay if I actually deferred that. I'm not sure about if Dr. Sadak or Dr. Schlack might have any comments in regards to organizational strategies around that, or I don't know.
So why don't we kind of review the homework, and then for whatever time we have left, we'll address the very big, important question. Is that okay?
Wonderful. Sounds great.
So we invite you all, again, thank you so much to our speakers. We hope you will all join us again in January. And to prepare to join us, you need to do a little bit of homework. So we're going to have Amelia review the homework on implementing organizational strategies. And this may actually answer some of your questions. So Amelia, if you want to give a very brief overview of the homework.
Sure. So here I've divided it into our 4 themes, which are autonomy, working relationships, resources and workload, and then lastly, administration, leadership, and management. And then within that, I've kind of given you like a few different points for where you could address autonomy, for example. And there are other ways to address autonomy, but these are a few examples and something to jumpstart you in the next month. So under Redesign Workflow, for example, I have a goal, what you want to accomplish, and then I have a specific homework that you can start doing. And I have one of these for each of them. And so it would be great if you could start them. You don't have to start all of them, but if you can get started on a few. And I imagine some of you in your organizations already have some of these processes in place. So maybe evaluating how well some of them are working. And then we can report back and talk more about it in the next session and what's working and what's not working. So we can think about essentially how we can move forward and come up with a plan and a strategy that translates well to practice.
Thank you, Amelia. And Emily, you already kind of walked us through the homework, but you're going to get a handout in a much larger print here that's going to give you the prompts of going through all the steps. Anything else our audience needs to know about the homework for implementing individual strategies?
Yeah. One thing is like kind of, I think it's good to track your own behaviors, and also as part of the motivation, like if you want to set up your own like calendar, or any sort of reward system or way to check off like, yes, I did it for that day. I did my, little self-care habit for that day. And I think it's also good to, if you journal, that's wonderful. If not, that's okay. But reflect a little bit on any barriers and successes that you've had. So when you've had barriers, these are things that we're going to be talking about in the next workshop in January, is to kind of like look at everyone's experience in doing it. What challenges did they have? How did they overcome them? Or we can talk as a group of like, strategies to maybe address some of the challenges or barriers in doing the self-care activities. But then also, as you do the self-care habits, to really reflect on what do you notice, anything that you notice as a result of doing this, any ways in which and you can also reflect, look back at Tatiana's stress continuum model. As you're in the green, the orange, the red, et cetera zone, are you noticing any of those changes in like decreased irritability, increased energy, increased motivation? What kinds of things are you kind of noticing as a result of doing this self-care activity, and how do you feel afterwards? And so those are things I hope we can kind of share as a workshop and group together too. Thank you.
Thank you very much, Emily. And yes, there's a typo on your slides. Our next workshop is on January 12th, 2022. Many of you shared some wonderful, important resources, but I want to address Shalon's very important question in a chat on how do you incentivize your leadership to implement and to encourage everybody in the system to utilize self-care strategies, and how do you keep track and keep people accountable? I'll just give you one example of a health system that I think is in the right track, is our Swedish Providence health system. Is anybody here working in Swedish Providence? Any representatives of Swedish Providence in a call? Well, if you hear, and if I'm misrepresenting, correct me, but it is my understanding from speaking with the wellness officer, the chief wellness officer from Swedish Providence, is that very early in the beginning of pandemic, they implemented a very simple tool that they call a stress thermometer. And it's part of the actually EHR, and it's a part of the app that every person who is working in a health system can access, where you kind of self-assess your current level of stress. And not only just tells you like you're stressed off the chart, congratulations, it actually allows you to open up with a click of a button the next field with resources that are available for you within this health system for your particular level of stress. So maybe you just need to speak to a counselor. Maybe you just need to alert, people around you that, you need more serious intervention. And here's, what are the next steps of getting that intervention? And they're studying it, kind of as a quality improvement process, and, considering it for dissemination broader within their large health systems and outside. So this is just kind of one example of acquiring data of how well people are doing and giving them very immediate resources. Because what we learned from the literature is that many health systems responded very robustly to try to put together, resources available for people who work in the systems. But then people who are really overwhelmed, they have difficulty even navigating those resources. Like you almost need a care coordinator when you're totally stressed and burned out for you to even understand what's available for you. And it can just be too much to even try to sort this out. So what Amelia was talking about, wellness boards, wellness officers, there's kind of whole new positions that are focused on wellness and helping people navigate existing resources and track existing resources are some of the examples that I'm seeing from local health systems and from the literature. Amelia, if you could maybe briefly comment on how do we incentivize people and keep them accountable for really encouraging individual self-care in addition to implementing organizational strategies?
Sure. I'm happy to comment on that. I think that the first part in these individual self-care mechanisms are so important. But again, kind of what I said earlier in my presentation is that foundational to achieving those self-care efforts are these institutional strategies. So to take breaks and reflect on your workday and to improve how you work with people and work with others, you really need the time and space to do so. And so that's why I talked about building in resources, and connecting with managers to see what's going on. So my greatest strategy and advice for doing so, and depending on your, level in your organization, from CEO to nurse manager or nurse, wherever you are in your organization, is to connect with the person who is overseeing you or working in partnership with you and thinking about how you can start implementing some of these strategies. And I think the best way is probably to start with a partnership so you're not alone. Starting with a partnership, and then maybe eventually you'll get to a well-being governing board. I hope that we'll all get there at some point. And I think not only healthcare organizations, but a lot of organizations are trying to do this because it's so important. And, we need a healthy workforce to do our work.
Thank you, Amelia. Thank you, Emily. And lastly, my kind of final parting thought is we also need to be keeping ourselves accountable to ourselves. So when I block something in my calendar for my self-care, this is the first thing that goes when I have an urgent thing come up. I would not cancel something where I'm committed to somebody else doing something else. But if I ever attempt to block something on my calendar that I'm only accountable to myself, I think many of you can probably share the sentiment. This is what goes. And I think based on what we learned from our amazing speakers today, it is our moral responsibility to be accountable to ourselves for our self-care, because only by receiving we can give, and we're all in a giving profession in one way or the other. So I hope you enjoyed the presentation. I hope we answered your questions, and we're really looking forward to seeing you all for experiential part 2, where we're going to work in small groups in actually helping each other develop strategies that work and sharing our experiences. Thank you so very much, everyone.
Thank you, thank you, thank you. Big virtual round of applause. Fantastic speakers, Dr. Sadak, Dr. Schlack, Emily, thank you. What an incredibly informative presentation, and really good questions and dialogue from the audience as well. You are exactly right. We do have the next session happening in January. I did post that into the chat box. It is going to be a registration format for that. I just put it in there one more time. If you want to go ahead and grab that off of the chat, that'd be appreciated. We also want to thank Healthier Here and Dr. Mclaughlin for joining us in this important event. And everyone, thank you, thank you. We really appreciate it, and we want to wish everyone a happy holidays. And we will see you again January 12th. The homework and all those slides will be sent out to all the network. And we do look forward to having you in the next session. Come ready to share out. Tell us what worked. Tell us what didn't work, so we can continue on this momentum to help our healthcare industry. Thank you very much. Happy holidays.
Thank you very much. James,
Thank you, everybody.
Thank you.
James, may we request that when people register for part 2, they have to acknowledge that they